We'll now have around 5-minute questions. Dr. Insel, did you say that 2/3 of those with mental health were smokers?
With serious mental illness, particularly with schizophrenia, the numbers even climb higher than 2/3.
Is that a lot higher than for people with diseases other than mental health?
Yeah, absolutely. I mean, it's not higher than when you look at males with lung cancer. They have very high rates of smoking as well. But as a group, I don't think there's any medical demographic group that has the high rate of smoking that you see in people with serious mental illness. And I might add that it isn't just that they're smokers, but the way in which people with chronic schizophrenia smoke is actually quite different than the way other people smoke. They consume more cigarettes, they inhale further, and they're much, much more likely to develop chronic respiratory disease as a result. So it's a huge comorbidity, a huge medical public health problem. We've launched, and SAMHSA's worked with us on many of these efforts, these new programs to get people with schizophrenia who are chronically ill to stop smoking. It is doable, but it's a tough slog. It's hard for them to stop, and there's always been questions about whether nicotine in some ways is a way of self-medicating, and we're not really quite, the science there isn't quite baked.
Dr. Frieden says that smoking still is the #1 killer in the United States, so